Take a look at this map here. I want to show you this. According to the CDC, states in the southeast have seen at least a 20% increase in total cases in just over the last 7 days. Florida and South Carolina, they really stick out here, both with more than 36% rises in cases. South Carolina is a state that health leaders are keeping a close eye on. Governor Henry McMaster pleaded with people for weeks to take this more seriously, but he has not had to put any new restrictions in place. At least he hasn't done it yet. We're going to bring in our Glenn Counts now, live tonight. Now, Glenn, you spoke with one health expert who thinks the governor needs to take new action right now.
Well, with Arizona, California, and Florida in the headlines, it's easy to overlook the fact that South Carolina's numbers are nothing to brag about. As a matter of fact, that has at least one expert saying we opened too fast, too soon, and way before we were ready.
We've been open for a year and a half now.
Tattooed Brews is located in Old Town Rock Hill. It's the business baby of Adam Perlowitz and his wife.
We're a mom and pop. My wife, Nikki, and I own this together.
Their business was crushed during the shutdown, but came roaring back to life. That's also true for South Carolina's economy. Unfortunately, so did the coronavirus.
And in hindsight, one must say that we did open it too fast and potentially too early.
Dr. Helmut Albrecht chairs the Internal Medicine Division at the USC School of Medicine.
We need to have a better response to this than we do now. This opening experiment has obviously failed.
Data from the CDC shows that South Carolina is third, right behind Arizona and Florida in terms of the percentage of new cases this week.
If we continue to go down the path that we're on, what's going to happen?
It will overrun the healthcare system. It will overrun public health resources.
Just this week, Rock Hill, York, and Fort Mill made mask wearing mandatory, but the governor has avoided a statewide mandate. Albrecht thinks at some point he may not have a choice.
Right now, I feel we have lost control of the outbreak again.
People are tired of it. They're tired of being micromanaged by the government at this point, being told what they can and can't do.
Perlowitz says he's seen plenty of coronavirus fatigue. He knows everybody's tired of wearing masks and social distancing, but Dr. Albrecht says the alternative is much worse, rising death and hospitalization totals and possibly another shutdown.
I would certainly have a state mandate for face covering. That's, in my opinion, that's the only way out at this point. But we have to do something. It's very clear that the current approach is not working.
So let's talk about there. He's talking about masks, and then we know in the last couple of weeks, cities in South Carolina did pass mask ordinances. So did he address any of that?
Well, he would say that it's great that they took that action, but he'd also say it was probably a week or two or three too late to prevent rising case numbers.